Welcome, everyone, to today's webinar, The Menopause Microbiome, Understanding the Gut Hormone Connection, probably my two favorite topics for healthy aging. I'm Dr. Lanae Mullane, naturopathic doctor and head of clinical strategy and product innovation here at Joi Blokes. And I'm here with Katy Whalen, our co-founder and CEO of Joi Blokes, if you want to say hi. And I'm thrilled to be your moderator, kind of going along with some questions today with the incredible Cynthia Thurlow, a perimenopause, menopause expert, nutrition educator, nurse practitioner, and author of the Menopause Gut. So today we're going to explore how hormonal changes during perimenopause and menopause influence the gut microbiome, something that we don't really hear about very often, and how we can use that knowledge to help women thrive through midlife and beyond. At the conclusion, we hope that you understand hormonal changes during perimenopause and menopause and how those changes influence the gut microbiome. We're going to explain the role of the estrobolome, a new word that is really making its way, not necessarily a new word in what it's been doing, but a new one, I think, in the vocabulary as of recent, estrogen metabolism and overall hormone health. And then recognizing the relationship between gut health, metabolism, inflammation, and of course, how they combine for healthy aging. Identify some lifestyle strategies, which are important so you guys can walk away with those today to support both hormonal and gastrointestinal health. And then, a more comprehensive microbiome and hormone testing and how those can be used to develop personalized plans. Katy, would you like to say a word or two before we get started, before I hand it over?
Yes, thank you, Lanae. Hello, everybody. Thanks for being here. I'm Katy, co-founder of Joi Blokes. Started Joi Blokes about 5 years ago based on my own health journey. I had a lot of problems going into, recovering from having babies and going right into perimenopause. And I can say I'm very excited about this conversation. I've followed Cynthia for a while, but personally, I never had gut health issues until a couple of years ago. And I can tell you, I think it was last year, I came to Lanae and I was like, please help me with these labs. What's going on? She's like, oh, there's some gut health issues popping up. So I am here really to make sure I get all my questions answered too. I want to understand like why all of a sudden I'm having these gut health issues, and I'm really here to as a patient as well. And so thank you both for being here and helping us fix all these issues that come in midlife.
Cynthia, thank you so much for being here. And before we dive in, would you like to share a little bit about your background and kind of what drew you to focus on the intersection of hormones and gut health?
Yeah, thank you so much. So good to be here. Good to see everyone. So I've been a nurse practitioner, gosh, for 25 years. I spent the first 16 years as a former adrenaline junkie in ER medicine and cardiology. So metabolic health is really where I started. And then 10 years ago, I realized that in perimenopause that my hormones no longer matched my lifestyle. And so I took a major pivot, started my own practice, and I've been firmly focused on women in perimenopause and menopause for the past 10 years. What's interesting to me is life imitates art. So in 2018, I took this romantic trip with my husband, went to Morocco. We ate the same food, we did the same activities, and one of us got deathly sick, which ultimately led to a 13-day hospitalization. And what I did not know, as someone who trained at one of the leading medical institutions in the United States, I had no idea what was going on with my immune function and my gut in a setting of declining hormones. And so I've been very gut centric over the past 10 years, but I really started to realize that not only was it me, but so many of my patients were experiencing gas and bloating. They were diagnosed with irritable bowel syndrome. They suddenly were intolerant of high fat foods in midlife. And I was like, here's the intersection of hormonal decline, changes in neurotransmitters, and how that impacts every single cell in our bodies. And so, what I've been able to do over the last 5+ years, kind of integrating a lot of what I was doing with my patients, was wrapping it up in a book called The Menopause Gut. And let me be clear, if you had ever asked me 20 years ago, 5 years ago, 10 years ago, that I was going to write a book about the gut microbiome, because we knew so little about the gut up until 5 or 10 years ago. It is still fairly new research, but now that I know, it explains so much. And I would actually make the argument that the gut microbiome is what interfaces with every single organ system and plays an enormous role in how we feel and how we perceive the world as midlife women. So I always say that, hormones are more than about bone, brain, and heart health. It is also about the gut. And although we don't yet have a clinical indication for hormones, and by that I mean hormone replacement therapy to support the gut microbiome, I think that will eventually come to pass, because the patients that I'm working with, the ones that were really diligent honing in on these things, are doing a whole lot better than women that like enter my programs and we realize, oh my gosh, it's really starting from a very much a ground up approach. So that is what kind of got me to where I am today. And the Menopause Gut is really a love letter to women. It's the book I wish I had 20 years ago, 10 years ago, to help prepare me as a middle-aged woman.
Thank you for sharing that. I think the synergies between you and Katy, also just having your own personal story, really leads a passion. And I feel like when you go through something, it just makes you so much more connected to patients who are also going through that same thing. Love that. And also, just as you know, in my field as a naturopathic doctor, just reminding ourselves that the body really is all connected and it's never just one or the other. So just for those who, may not understand a little bit about menopause and that transition, let's kind of start with the big picture. Let's talk about perimenopause and menopause. Obviously, there's some people out there, hopefully not as many now, with more voices like yours and Joi Blokes out there, but some people can think it's simply more of end of periods, maybe get some hot flashes, some night sweats. So talk us through kind of more the broader physiological changes that happen during this transition and why it's kind of more whole body.
Yeah, I still think there are a lot of people that think about perimenopause and menopause as a fertility ending event. And I like to remind women that every single cell in our bodies has a receptor for progesterone, for estradiol, for testosterone, and that doesn't end when we no longer are fertile. So when we're thinking about perimenopause, and I think given the fact that the number one endocrine disorder here in the United States is what was formerly called PCOS, now called PMOS, which really speaks to a broader metabolic health issue. That's the number one endocrine disorder. So there are many women that in their mid to late 30s, Katy mentioned she had pregnancies and then was immediately in perimenopause. A lot of women are getting symptomatic a whole lot earlier. So what really starts perimenopause, we know, is the ovaries start producing less progesterone. And that may show up as during the luteal phase of your cycle, after ovulation, right before you get your menstrual cycle. You may have more anxiety, more depression, more intrusive thoughts. You may not sleep well. You may just be really irritable. And for a lot of women, we chalk it up to, I've got little kids. I'm not getting enough sleep. That must be what it is. That's certainly what I experienced. And so that is the very beginning. And in that setting of less progesterone in that luteal phase of your cycle, we get something called relative estrogen dominance. Now, traditional allopathic medicine hates that term. They get very angry when they hear me say it, but I said it really is. If hormones are a symphony, the symphony is now out of tune. We have relative estrogen dominance, which means our cycles may be heavier. You may start having more cramping. You may experience more breast tenderness. You may have more brain fog. You may have more digestive issues, bloating, constipation, diarrhea, alternating between both of them. I mentioned earlier, a lot of women get IBS diagnoses at this point in time, which is to me a catch-all. It's literally, we don't know what else to deal with you. So we're going to give you this kind of catch-all diagnosis, which really doesn't allow you to do a whole lot other than treat the symptoms. A lot of women experience brain fog. And so they kind of exist in this space of occasionally during a menstrual cycle, they may have estrogen that's 20 to 30% higher than at any other point in our lives. So explains why women just don't feel the same. And so you have this perimenopause, early perimenopause, less circulating progesterone, relative estrogen dominance, and then you kind of go through the middle of perimenopause, and then towards the latter stages, depending on you as an individual, and this is where I think cycle tracking is very helpful to really get a sense, because we're oftentimes telling patients, oh, you don't really get those drops in estrogen till the end. That may not be the case. I think there are many women that are becoming quite symptomatic of low estrogen in their follicular phase a whole lot earlier. So that may show up as vaginal dryness. You may have hot flashes, a lot of those vasomotor symptoms. Again, anything that, skin feels dry, irritability. Like irritability is absolutely the number one symptom other than hot flashes and night sweats that my patients experience. So they're just irritable. Like there was a meme on social media that my husband was looking at. I think it was Molly Sims. And he said, the woman said, how do I know I'm in perimenopause? And they're like, just your husband breathing is irritating. And my husband said, this makes so much sense. So I think a lot of it is the irritability in the setting of low estrogen. So low estrogen can happen in the middle of perimenopause, not just at the end. As we're kind of running out of hormones, we don't really run out of hormones. We just have less circulating hormones.
Mhm.
We may see more longer cycles, lighter cycles. Those vasomotor symptoms may increase. I think of those vasomotor symptoms, hot flashes, as really a litmus test of metabolic health, because we know the women that have the worst hot flashes generally also have cardiovascular disease outcomes that are generally at an elevated rate. So a lot of things can happen: fatigue, memory issues, brain fog. A lot of those things can happen. Perimenopause is as individual as the woman is. Just like when we went through puberty, a lot of women went through it unscathed. They didn't have any awkward moments. The rest of us had lots of awkward moments and lots of symptoms. The same thing happens in perimenopause. So 12 months without a menstrual cycle, average age here in the United States is 51. If you go into menopause before the age of 40, that's premature, and that is very significant. You need hormones at different levels than an older woman. And early menopause is before the age of 45. So think about it this way: what is considered to be normal is going into menopause anywhere from 45 in one day to 55. That is a tremendous variance in the amount of hormones our bodies are exposed to over time, and why I'm such an enormous proponent of having these conversations with women way before they go into menopause, because we know the outcomes are better for women if we initiate hormones earlier rather than later. But then again, if you're in the later category, that's okay too. Just requires a little more finesse. So that's kind of a basic overview. We also know that women, once they go into menopause, it changes our cardiovascular disease risk. It changes our bone health risks. It impacts our neurocognitive status. And while we're talking about the gut, it also impacts the way our gut responds in time with those confluence of changes in hormones, fluctuating hormones, plus or minus changes in neurotransmitters too.
I love so many pieces of that. I really connected. I love that you noted just again, every cell in the body has a receptor for things like estrogen and progesterone, which is a big piece because I think that progesterone piece definitely gets kicked to the side, particularly with women who've had hysterectomies, as like, oh, wait, you don't need it anymore, or only that it's a uterine protectant when you're on estrogen, when it does so much more. But you touched in so many different pieces. Again, it's not that just the hot flashes and night sweats, but again, early on symptoms, that sleep disruption, and definitely the irritability, which now I'm like, it's been a long time since I've been in perimenopause then, because I get that quite a bit, but might also just be my partner who I love. But yeah, definitely so many pieces that are connected and not just kind of our stereotypical pieces, which are very important too. But again, those small little shifts affecting things like you said, bone health and cognitive health, and for women in particular, cardiovascular health, which is important. Transitioning now from that, which was such a great overview of kind of that transition and what can be affected and the ages of that, shifting now to like the how that really focuses on the gut. So for everyone, in the audience who's maybe newer to this topic, kind of a little bit more, let's talk about what the gut microbiome is, what it does, why it matters to overall health.
Yeah, it's interesting. When I went through my medical training a long time ago, we knew nothing about the gut microbiome. So it's 40 trillion with a T, bacteria, viruses, fungi, and protozoa that are a mini city in our large intestine or colon. So there are more of them than human cells in the body, if that just like blows your mind. To give you the magnitude of scale of the gut microbiome, and it intersects with every single organ system. Like there's a gut ovarian axis, there's a gut bone axis, there's a gut brain axis, et cetera, et cetera. And it really speaks to the fact that there is a very sophisticated communication system between the gut microbiome and all these organ systems. Like, did you know that the health of your gut microbiome will impact when you go into menopause? Like, that was staggering research when I looked at it. Do you know that the health of your bones are largely dependent, not on your estrogen patch, it's also dependent on the health of your microbiome? So I think for a lot of individuals, it's helpful to understand like where is it located. Then also there's like several inflection points throughout our lifetime. First, how we're born, and none of us can change how we were born, whether you're vaginal delivery or C-section, whether you are breastfed or formula fed, imprints your microbiome in quite unique ways. There's three P's, so I always refer to it as puberty, pregnancy, perimenopause. If we live long enough, we will go through at least two out of three. Not all of us get pregnant, and that's okay. Puberty is a huge inflection point because this is where young boys and young girls, they get a huge differentiation that is heavily influenced by estrogen, progesterone, and testosterone. Now we know that testosterone, we have 1/10 of what men make, but it's incredibly potent in our bodies. But that differentiates the microbiome. It's also differentiated when we go into pregnancy and then perimenopause. Here's the irony, like life comes full circle. In menopause, in the setting of less estrogen, progesterone, testosterone, in most instances, our microbiome will go back to resembling a male's, but it's not to our advantage. There are some very unique attributes of the microbiome that remains pretty healthy and consistent throughout our lives, although heavily dependent on, standard American diet, alcohol consumption, chronic stress. But in menopause, unless we're on HRT, that microbiome starts to look more like a guy's. And that's, again, not to our advantage. So there are a lot of things that we can do proactively. Like I always like to lead with the positivity. There's a lot of things we can do, but it is a catastrophic impact on the body when those hormones decline. And it's why the work that you all do in Joi Blokes is so important, because you're helping to educate women like what their options are, like what are the things we can do proactively. Because I will tell anyone, and it makes several people angry, just a few people. Menopause is normal if we live long enough, but it's not optimal. And I don't want to be normal. I want to be optimal. And part of that optimization of the perimenopause to menopause transition is really thinking about how hormones impact our health dynamically and systemically, like throughout our bodies, not just fertility medicine or bikini medicine, where we just think about our reproductive organs as being the only site of where these very important hormones work. It's understanding that these hormones work in every single cell in the body, and why, even if you had a hysterectomy, you still need progesterone. Like that is a hill I will die on because I get so frustrated when a GYN will refer someone to me and they'll say, but they don't need any progesterone because they don't have a uterus. And I was like, but they do need progesterone because they have receptors outside the uterus. Like that is an important distinction to make.
Yeah. And also, I'll just chime in and say the distinction of need versus deserve or like will benefit from is very, very different. I wanted to ask, when you're talking about the difference between men and women and gut health, so were you saying that generally we have better gut health than men until we hit
No, well, it isn't that we have better health. It's that it's the influence of key hormones. So like obviously men have more circulating testosterone. They're going to have differing keystone bacteria than women do. But as our hormones are declining, it's killing off beneficial bacteria, it's changing inflammatory patterns, it's in changing immune system regulation. It is changing a lot of things. Like I always say, like guys really have it so much easier than women do. They have their hormones tend to be more stable. Their decline in hormones is a little more gradual. Our modern day lifestyles are definitely impacting men because there are two reasons why we're seeing low testosterone in men. Number one is exposure to endocrine mimicking chemicals. Number two is insulin resistance. So is it normal to see men with low T? No, but our modern day lifestyles definitely influence it. But we have to think about different genders have different microbiome constituencies. And so when I say that our microbiome start to resemble a male, it's because we're getting differentiation in the beneficial bacteria. The keystone species are changing. It also explains why we start seeing more autoimmune disease. We start seeing more cardiovascular risk. There's a lot that changes that's not to our benefit. And so we have to be thinking thoughtfully, like men and women are their own distinct entities and our bodies aren't meant to function the same way overall. Hopefully that's clear.
I think it's like you said, with how many trillions of bacteria are in the gut. I remember hearing a marine biologist say every time she goes to the deep ocean, they discover like 10,000 new organisms. And I feel like the gut microbiome is that, like we're always discovering and learning so much about it, kind of like the deep ocean. I also remember being at about a decade ago, American College of Rheumatology, and there was a talk on the microbiome, and it was fascinating, especially at those conferences, which tend to be a little bit curmudgeon-y, to be open to how even just diet changed that gut microbiome and how far we've come. So I'm so grateful that it's becoming, again, much more common in discussions. And again, just somebody like you bringing it to light, bringing the hormone piece of it, just like you said too earlier with PCOS changing to PMOS, I really think that also just opened eyes to hopefully more people who are in this space already knew it, but hopefully to others who weren't, about how that metabolism and hormones, all of that connect so so much together, and they're really intertwined. Moving from the microbiome, now we have a little bit of understanding of perimenopause and menopause and the gut microbiome. Let's now kind of move into the really, I think fascinating topic, which is the estrobolome. Making sure I say that correctly. For those who haven't heard this term before, can you explain what that is and why it's so important?
Yeah, I'm going to share something funny with you all. So throughout the book launch phase, I would have a lot of male podcast hosts that would call it the estrobolome. So I'm going to leave that with everyone. That's not how we technically say it, but the estrobolome just makes me laugh. So the estrobolome is a special amount of bacteria that are designed to break down and metabolize estrogen. So probably not surprising that our liver and our gut are involved in metabolism of all hormones, but in particular estrogen. And so I always think about the estrobolome as its main role. Like, so we have two phases of detoxification in our liver, and the third phase of detoxification is really the gut. And so, yes, we urinate, we defecate, we sweat, we breathe. All those things help with detoxification. But the heavy hitters in the body are the liver and the gut, and then obviously the kidneys. And so the estrobolome's role is to break down into water-soluble compounds and package up excess estrogen. And here's the Goldilocks effect. For each one of us, there's very much this fine line of like too much estrogen or too little estrogen, which can magnify symptoms that we experience. But the bulk of the estrogen is designed to be bound up, with bile acids and fiber and pooped out of the body. And I was told recently that using the word defecate is too clinical. So we're just going to say poop because we all know what that is. But we want a little bit of that estrogen to be recirculated. And again, Goldilocks effect. Too little, and we're going to have vasomotor symptoms, night sweats. We may have brain fog. We may have more vaginal dryness. Too much, and we might get the opposite effect. And so this may be breast tenderness, weight loss resistance, again brain fog, which I see it just depending on the woman's bio-individual approach. Some people may have brain fog with high and low estrogen, but understand these neurocognitive changes that can occur. This is one of the things that I think is fascinating, is we have normalized constipation in women. We have told women that it is normal to poop 2 or 3 days a week. And I tell my patients all the time that, bowel frequency and comfort levels are very unique, right? Like I have some patients that poop 3 times a day and that's normal for them and it doesn't bother them. I have others that want to go once a day. I have others that don't want to go once a day. But I help them understand that if we are not effectively eliminating excess estrogen, one of the things that can happen, it can magnify all these symptoms. So really working diligently on doing the things that are going to help women poop more often. So hydration, so easy to get dehydrated. And actually, as we're losing hormones, we lose those receptors that kind of guide us and let us know, like, you need to drink water. It's important for you to remain hydrated. Fiber is so controversial. I refer to it affectionately as the new F word, because depending on who I'm talking to, fiber has been deprioritized, but fiber is very important for helping to bind up excess estrogen and get rid of it. It helps to kind of work with bile acid synthesis, bind things together and eliminate them from the body. And fun fact, I don't know if anyone knows this, when I was deep in the research for the book, as estrogen's declining, we become more fat malabsorbed. I have a lot of patients that will say to me, I used to be able to eat that ribeye or the duck or the salmon, but all of a sudden I eat it and I feel nauseous. I don't feel well. It's not always a gallbladder issue per se. It is probably with declining estrogen, we have a decline in bile acid synthesis, and you may result from that. You may actually have more issues with breaking down fat. You may have fecal fat in your stool. If you have stool testing, that might be one of the things that they see. And I think for a lot of patients, they're surprised to know part of that elimination pathway really becomes important. But again, yet another reason why we want to support estrogen is it's actually helping with digestion and a lot of other things in the gut. But that's the estrobolome, not pronounced as estrobolome, but it makes me laugh. And so I like to share that with everyone so everyone can have a good giggle. I did not make that term up. It has been around since the early 2010s. A lot of good researchers that are doing work in this area. And here's the thing that I think is interesting. The estrobolome, the health of the estrobolome is heavily influenced by our lifestyle. So if you were on oral contraceptives, like most of my generation was, for every malady you can imagine about menstrual irregularities, heavy cycles, acne, contraception, plus or minus all the above, that heavily influences the estrobolome. So many of us were heading into perimenopause not realizing that the estrobolome was not as vibrant as it could have been. And I always say, know better, do better. We can't do anything about the past. But one thing that I find really interesting is the bulk of the women I work with are north of 35, and almost all of them were on contraceptives, synthetic hormones for 5, 10, 15, or even 20 years. So there's a lot that we can do to support the estrobolome, really important for estrogen processing in the body.
Do you mind if I ask a couple of questions? Because
Sure.
what I picked up from that is obviously hydration, fiber, but practically, when you're saying drink water, hydration, is water enough, or do you need to? What's your thoughts on the electrolytes? And then for fiber, are you saying just eat more fibrous foods, or would you recommend we supplement there too?
Yeah, great questions. I mean, I'm a fan of electrolytes. Remember, my background's in cardiology, and I find that most of my patients, I'm encouraging them to salt their food with high quality salt. Electrolytes, I'm a huge fan of. I live in a very humid part of the United States, so electrolytes are just part of what I do. So I do find that patients benefit from the addition of high quality salt, like Redmond salt. I have no affiliation with them. There's a lot of electrolyte companies. I would say find one that works really well for you. I also like Quinton ampules. These are literally like little ampules of saline that you can add to your water. I do that as well. So if you don't want anything that's flavored. When it comes to fiber, I always encourage my patients to track before we start increasing, because if your microbiome is getting 5 to 10 grams of fiber a day total, which is what we see in the standard American diet, if you try to increase to where the studies tell you, anywhere from 25 to 30 grams, the microbiome isn't ready for that increase in fiber. You'll have a lot of gas and bloating, and then people are very unhappy. So, food centric recommendations are always at the forefront of what I'm doing because I think it's that important. Now, if you need to add in fiber supplementation, I find that, it's very bio individual. I have some patients that are very sensitive to inulin. I have some patients that do better with soluble versus insoluble fiber. I think the most important thing is just to eat more. We're starting to see higher rates of colorectal cancer. And so some of the working hypothesis when I talk to experts that are doing colonoscopies and gastroenterologists is that low fiber diets may be contributing. There's probably other things as well. But great questions, ones that I answer with some frequency. I do like electrolytes. I do like fiber, but I prefer patients get it from food. And then a variety, like I always give this example, plant-based fiber, like legumes and beans, you don't have to eat tons of it. And we know as women's insulin sensitivity is decreasing in the setting of less estrogen, we have to be mindful of carbohydrate portions. And so sometimes it's, being thoughtful about adding a couple tablespoons of beans to a salad, or it's adding in some legumes, or it's just thinking thoughtfully about where you can add in more fibrous vegetables into your diet. I think for people, like, we are a culture where everyone loves to supplement. And I'm like, supplements are fine, but try to get it from food-based sources first. I think that's what's best tolerated. I think that supplementation can be helpful, but again, you have to be careful. Like, I'm very sensitive to inulin. Ironically enough, my gut microbiome testing shows that I need more inulin. So I have to be really careful with portions of inulin. I do add it into protein shakes, but I have to be careful with it because too much of it will cause tremendous gas and bloating. And this isn't someone who can tolerate up to 50 grams of fiber a day. So, like, my microbiome tolerates more than most, but that's been a deliberate slow increase over time.
Great point on that. Again, supplementing should be supplementing the diet, and a good point there, and definitely adding on when sometimes it's harder to get through food, but food should always be first is something I always say too. And I also appreciate saying the word poop. Hopefully now with that unfortunate cyclospora parasite, people are talking about poop more than ever. So hopefully that part becomes a conversation where we're comfortable talking about it. I love going to the grocery store and looking at everyone buying the fruit, and we're all like, we're taking that chance. Let's do this together. So hopefully again, people are more comfortable talking about it. But also another point too that you mentioned, which I also touch base with patients on, is if you aren't eating a lot of fiber and you start to slowly, like you said, slowly do it, because it can take a big effect. It's pretty powerful stuff, going a little bit slower. A lot of you will have some gas and bloating, and that can be a release of that bacteria releasing a little gas and bloating. It's not necessarily a negative thing, as depending, obviously, if you have ulcerative colitis or IBD or some type of, there's many different pieces, SIBO pieces too. So I'm not saying in general, but a lot of times you will have a little discomfort as you're adding in a little bit. I saw great research that was saying if you add in slowly and you stay consistent for about 2 weeks, your gut microbiome tends to be able to adjust, to be able to tolerate it. So I'm always like, just blame it on your partner, your kids. You're going to be a little gassy, a little bit uncomfortable, obviously not to the pace where it's painful. Initially, especially for people who aren't eating a lot of fiber, it can be a little bit uncomfortable initially. And then also, it's a great point that you're saying with diets and this piece with the colon cancer risk. I mean, I think there's many different pieces to it always, but diet is such an interesting thing, especially with this big and a lot of big influences on diets that are very specific in just one thing, whether not pointing things out as right or wrong, but more carnivore based, which there is not a lot of fiber in it. You're just getting one, heavily influenced food group. I find, again, really that balance is always a good thing. Like you said, as we get older, sometimes we may need to watch our carbohydrates and what form we use them and how much we introduce them in. But a lot of times we're missing complete food groups by sticking to something specific. So again, can be important for people, whether it be cultural or, something that they're trying to try out. But for the most part, having that balanced diet can be important for many things, because just like the body influences each other, our nutrition, we need nutrients for different pieces too. They're all beneficial in their own sense, depending on the moderation. So you touched base on nutrition. So we talked about things like fiber, but let's talk about things like polyphenols or maybe even fermented foods. Can you talk about that?
Yeah, no, they're all really important. And, polyphenols are signaling molecules that are in those brightly pigmented fruits and vegetables, things like extra virgin olive oil. What's important is that we're eating a variety. Like I always say, you want to have a plate that is not just a potato and chicken and a bread roll. Like you actually want to have those vibrant colors, because it's providing valuable signaling information, signaling molecules to the body. So whether or not it's a combination of, I always say 3 vegetables to 1 fruit, because as a culture, we like fruit, we like sweetness. And I'm like, fruit has a place, and especially in light of this current cyclosporin outbreak, I think most of us are cooking our vegetables or being really conscientious about where we're sourcing them from. But when patients are plating food, I always say, like, just think the brighter, the better. Like maybe try something new at the farmer's market when you go to the grocery store. That's what we're really looking for. And polyphenols are generally bitter. This is, again, something most Americans really get turned off by, but like your olive oil should be pungent. It should have a bite to it. That's going to be generally not what you're finding in the grocery store. Higher quality extra virgin olive oil is going to be not also inexpensive, but should have a bite to it. Just like radicchio and freeze, like some of these bitter plant-based compounds are the polyphenols are what is driving some of the bitterness. And bitter is important for digestion. It's important for our bile acid and gallbladder flow. And so just understanding that, sometimes we have to have small amounts of bitter foods that have a lot of benefits. Obviously, fermented foods are huge. If we look at a head-to-head between ferments versus probiotics, the ferments are always going to win. I always say to patients, if you tolerate dairy, kefir, organic full-fat yogurt, thinking thoughtfully about miso, tempeh, thinking about fermented vegetables. Like again, it's the farmer market season. where I am. So I'm always picking, my kids call it the science experiment in our refrigerator, but I don't ferment my own foods. I just prefer to buy them. But, you know, it's 2 tablespoons of kraut on a plate with a meal can be hugely impactful. That is more valuable than having a probiotic. Now, I will say the caveat is if your microbiome testing shows that you are deficient in a particular probiotic strain, that's different. But I think as a general rule, the ferments, you know, 2 to 3 servings a day, low sugar kombucha. Don't overdo it on the kombucha because I have a lot of patients that'll drink 3 or 4 bottles a day and then they're developing histamine issues, which is a whole separate conversation. But just finding things that you like. Like I actually will consume, not during the summer, but most 3 seasons out of the year, some warmed miso before I go to bed with some fermented plum paste. You can get the plum paste on Amazon. It's delicious. I actually had a podcast guest that recommended that, and I was like, it's just part of my evening ritual when it's not 100 degrees.
Wait, you put plum paste with the miso?
Yeah, I put it inside
Okay.
of it. Yep. It has like kind
I
of,
gotta say, I recently discovered like Whole Foods has the organic miso paste, and I'll just
yep.
put, it's so easy. You just put that in warm water and drink it and I love it. But I've never heard of plum paste, so I'm
Yeah,
curious.
so it's a fermented plum paste, and the name,
Uh,
like the technical name, but you can just Google fermented plum paste on
okay.
Amazon, and I've now put those together. So you're getting like 2 fermented foods at once, and it's just a small amount. Like the container's fairly small, and it lasts me several months. But miso soup is something I have most nights. But I think for a lot of people, we overcomplicate the ferments. We're like, oh, like my husband loves. Why am I drawing a blank? This occasionally happens. Korean cabbage, for whatever reason, I'm like drawing a blank, but
Kimchi?
thank you,
Yeah.
kimchi. He loves it, but it has a very pungent odor.
Yeah.
And so I always say, like, I love all ferments, but that's one I don't love. It's just a
Yeah.
little too pungent for me. But he has 2 or 3 servings a day. He loves it. So just find ones that you like and consume them, you know, a few times a day. You don't have to have huge portions. Like when you think about a kombucha bottle, that's like 3 servings or two. So you don't have to, it may not seem very cost effective if you're drinking a whole bottle at once. That's not what I'm suggesting. You really get the benefits. You want to keep it under 5 grams of sugar per serving. But you really get a lot of benefits from just having some degree of variety. But ferments are high on the list of things that I think are really helpful.
Yeah, and just a note to June, which is a kimchi instead of using, or a kombucha instead of using black tea and sugar to ferment, it uses honey and green tea, which can be a little bit easier sometimes for those to use. But I will say real quick before Katie jumps in too, I love the colors. It reminds me of Deanna Munich, who's so big in that space, and her talking about Eat the Rainbow. She's an artist put in with her PhD, and she's so beautiful about eating the rainbow. And it's not always, like you said, it's not about every single meal having something different and a completely different. It's just adding something seasonal in on your plate that's a little bit different can be helpful. Go ahead,
Yeah,
Katie.
farmers markets can be like
Ah,
totally, yeah, umbiyashi, that's what it is.
mhm.
And kudos to Dr. Lindsay Berkson who brought that to my attention. So there's never an excuse, like just find something you like, have some servings, just understand that that is really powerful information to the gut microbiome. And certainly
Yeah.
in midlife, we need more, not less.
Mm. I was just gonna pipe in and ask, Sherry was asking about, has anyone studied oxalates? I can't,
Yeah, they're
I need
plant.
my old person glasses, but yeah, if you guys could, if one of you could speak to that.
Yeah, you know, it's interesting. I literally just finished recording a podcast with a guest and we were talking about plant defenses. When patients tell me they don't tolerate oxalates, saponins, lectins, I automatically think there's healing that needs to go on in the gut microbiome because we should be able to tolerate these plant defenses. What I find for a lot of women, they're in the low carb ketogenic space. They're trying to find like a healthier version of a cracker or bread, and so they're
Mhm.
eating a lot of oxalate rich foods, you know, things that aren't fundamentally unhealthy. But if you're having a lot of almond flour pancakes and almond flour bread and almond flour crackers, over time, cumulatively, that can become problematic. So remember what I mentioned earlier when I was in the hospital for 13 days and had 6 weeks of antibiotics and antifungals. I spent about 2 years of my life being unable to tolerate oxalates. And so I always say, as my gut healed, I was able to tolerate oxalate rich foods, things like celery and kale. And I know Dave Asprey loves to talk about how, you know, killer kale. When people tell me that kale bothers them, I'm like, it's probably more a reflection of what's going on in the gut. So just, you know, my overall gestalt is plant-based defenses should not bother us. if our gut microbiome is optimal. If it's not, it's probably a sign of additional work that we need to be doing to heal that, whether it's healing and sealing the small intestinal lining, which is only one cell layer thick, whether it's working diligently at reducing inflammation. And let's be clear, only about 92 to 93% of us are not metabolically healthy. So there's a lot of people that are impacted by this, but we should be able to tolerate plant defenses. That should not be a problem.
I'm so grateful you said that. I feel like, depending on who you talk to, they really, can give food such a bad name and again, in certain situations, everyone, and mentioned earlier, is personalized, and everyone needs to be, approached in that way. And then maybe they need to do some healing before they add things in. But I tell patients all the time, a healthy gut should be able to tolerate most things some of the time. And if somebody comes in saying, I can't do that, I'm like, let's figure out why. And not that we just have to say that that's the case and we're moving on and you never get to eat those again. It's really about how can we figure out so that you can have it and it doesn't affect you as much. Moving beyond, though, the role of diet, which we know plays a huge piece of our microbiome, what role does physical activity play? And also other things like sleep and lifestyle pieces.
Oh, it's everything. I always say major in the majors. The majors are sleep, stress management, nutrition, and exercise. So the research is pretty clear that the quality of our sleep, the way we manage our stress, the way we exercise, and the nutrition we eat has a huge imprinting on the microbiome. So let's start with sleep because I think it's so foundational. What I find is that sleep disruption is real, whether it's because we had babies in our mid to late 30s and it buffers up against perimenopause, or we're just struggling with sleep overall. We know based on the research that the less sleep you have, the more impact it has, not just on your microbiome, but also metabolic health. So I tell women to aim for 7 to 8 hours a night. If you're not sleeping, we want to figure out why. Is it because you don't manage your stress? Like I will say all the time, show me a woman who doesn't sleep and show me a woman who doesn't manage her stress effectively because we become less stress resilient. So whether or not it's dealing with sleep hygiene or we're layering in supplements, and I have my favorites, or we're also plus or minusing, addressing HRT can have a huge effect. Stress management becomes critically important. We know that cortisol, which is a super important hormone, and for all of us that are speaking live on camera, I'm sure if you measured our cortisol right now, it'd be up a little bit because we're engaged, we're excited, we're having this conversation, but it's chronic cortisol activation over time. And thinking about cortisol in the hormone hierarchy, cortisol trumps just about everything else. But when cortisol is high, so is insulin, so is glucose. You're more likely to deal with metabolic health issues. It catabolizes muscles. So the very precious muscle that I'm telling all my patients to build and maintain, it will actively break that down and catabolize it. It impacts immune system regulation. We're more likely to deal with leaky gut. Women are 4 to 5 times more likely to develop autoimmune diseases in midlife because of the immune system changes that we experience. So I remind women all the time, stress management is non-negotiable. Like I live in a house, we built a house 5 years ago. Every window I look out, I see something green. That was purposeful, very deliberate. Now I recognize not everyone lives in the suburbs. Some people may be in a city. Finding things that bring you joy and are de-stressing. That could be grounding. That could be walking your dogs in the morning in the sunlight with your spouse, which is what we do. It could be joyfully interacting and engaging with people you love. It could be hugging your pet. It could be an orgasm by yourself or with your significant other. There's a lot that we can do to de-stress. And then there's supplements we can layer in. And I'll be the first person to say that a lot of women that are dealing with a ton of stress and anxiety, it is again a hormone deficiency that is driving that. We know that as our hormones are changing, so progesterone impacts GABA. GABA is our main inhibitory neurotransmitter. Serotonin synthesis and dopamine are hugely impacted by estradiol changing. So those neurotransmitters are important. And the other thing to mention, I mentioned in the beginning that there's a gut-brain axis. About 90% of the information goes from the gut to the brain. So if you are not sleeping or able to manage your stress, it can be a gut health issue. That's where gut microbiome testing can be really a huge differentiator. So when I'm talking to patients, I'm like, you must manage your stress, find things you like and do them often. Meditation, breath work, some of the other things I mentioned, and then exercise. So again, the Goldilocks effect, the intense, CrossFit conditioning classes I did in my 30s did not serve me well in my 40s. So it's the right types of exercise. Obviously, we need to strength train, we need zone 2 training, we need flexibility work. The recovery becomes so much more important. So when women tell me they're doing Orange Theory Fitness 5 or 6 days a week, I'm like, that is a mini stress test to the gut every time you do it. That intensity of exercise, that intensity, that chronic cortisol activation, probably not doing you any favors. And this is incredibly triggering. I'll also dovetail and mention when we talk about nutrition, we talk about meal frequency. Intermittent fasting isn't the right strategy for everyone. However, digestive rest, which I talk about in the book, 12 to 13 hours of not eating, is something all of us can do. It is not just, older adults. So I think, thinking thoughtfully about these majoring in the majors, all four of these have a huge impact on how we can navigate midlife and beyond. And also need to be, the first things that we're doing, not buying the Oura ring, not buying the newest supplement, not running to get testing done. Although testing is important, if you have not dialed those in first, you're not going to have the same sustainable long-term results. And sometimes that makes people angry when I say that, but it's the reality. We have to change our lifestyle to match our physiology. You cannot exist like you did at 25 or 30 or even 40. For a lot of us, it has to change dramatically. And that's okay. Like, I think for those of us that are thriving in perimenopause and menopause, it's because we've had to make those changes. It can be hard. The concept of surrender can be challenging, especially for those of us that are type A. But that can be a really vital component to how effectively we feel in midlife.
Oh my gosh, absolutely. Again, just showing how the body is so connected. I definitely think the sleep piece, having two little toddlers in the bed, is contributing. So I'm going to I'm reevaluating that in my mind right now. But definitely just showing how, I think anything that comes up when it comes to our overall health, those pieces like stress management, as you noted, are so important. And also, when I see patients, tell them you have to utilize them as a tool in your daily life to make it an easy tool to grab. If you only use it when you're stressed, guess who's not going to be pulling that initially? You, because it's hard to think about it. So utilizing it as something, I love to connect it to something that people do every day. If it's not a meditation or a walk or, talking to friends, if it's actual breath work or utilizing that to connect it to something you do every day, whether that's sit down, taking 4 focused breaths before you eat your food, helps with that, put you in that parasympathetic state, which is important, helps you digest that food a little bit better. Just making sure you have those tools, but you practice them. That's a big piece to become a habit, and you're not trying to pull them when you're in those stressful states, because that can be really tough. Now, you mentioned, definitely these are the fundamentals which absolutely need to be in place, but also that testing can be, once you have these, or starting to acknowledge that these are important, to do some testing. So talk to me a little bit about, when it comes to comprehensive gut microbiome assessment and testing and measuring, what do you look for? What does that look like for you?
Yeah, I think I've been doing a lot of stool testing over the past 10 years. And so what really kind of fell into my lap was microbiome testing, because it's so much more precise, using shotgun genomics, which is a different type of technology. We're able to really fine tune what we're looking at. So looking at beneficial bacteria, looking at, are we showing signs of poor detoxification? Are we very specific about what strains of bacteria do we need to reintroduce to the microbiome? What types of foods? The thing that's been really helpful with microbiome testing, and I'll use myself as the example, when I did my last microbiome testing, I had to laugh because I mentioned earlier in a conversation, talking about different types of fiber, insoluble, soluble, inulin, these types of things. What did I say to myself? Oh, I don't tolerate inulin. Well, why don't I tolerate inulin? Because I don't have enough of the bacteria to break inulin down, which is why it produces gas and bloating, and why I avoid it, which just perpetuates the cycle. So it allows us to be much more precise. It allows me to be much more precise about nutritional recommendations, supplementation, other interventions that is unique, as unique as the individual. There are no protocols in my world. It is really fine tuning very specific protocols. And then, quite honestly, the results that we're getting are phenomenal. Like, I also do vaginal microbiome testing. And I think there's this prevailing thought process, well, you just need to take hormones for your vaginal microbiome and that fixes everything. Not correct. It doesn't reestablish the keystone bacteria in the levels that we want them to be. So I've had women who have been on vaginal estrogen, as an example. We do vaginal microbiome testing, and all of a sudden they're like, oh my gosh, we repopulate with specific types of probiotics. We're using specific interventions. and then the painful sex goes away in conjunction with the HRT. So I think for everyone listening, it's understanding that there's a degree of precision medicine that's allowing us to have much more personalized recommendations and much more personalized experiences. So I'm getting much better outcomes. And that to me is really exciting because, whatever testing we're choosing to use as clinicians, if it's not improving outcomes with patients, then we have to think about, is it really that valuable? And so I think the microbiome testing is like next level. And for everyone listening, whether you've had microbiome testing or not, give it a chance because I really think it has the opportunity to take your health to another level. Like every intervention I've been doing since I got mine most recently, I was like, oh my gosh, I didn't think this was really a big deal, but it is a big deal. I feel differently. And I think that's what's exciting.
I think that's so important. Just one piece on that vaginal microbiome, as you noted with HRT, it's actually kind of common also when you're using vaginal estrogen to get yeast infections because you're changing the bacteria of the vaginal canal. And so important just again to show how connected those are. So just like you said, you can't forget about the bacteria that live there too and to support that. Now, when it comes to microbiome testing, I am so on par with you. I think, I've done a lot of stool testing as well. Can be useful in certain things where we're looking for blood in the stool, certain pieces, but a lot of times it is so variable. It doesn't give me a lot of clinical relevant information per se and can be changed based on the same stool. So it's a little bit harder for me to utilize in practice, but that microbiome testing, which it was a big piece for us to get at Joi Blokes because we do know the importance of it and how it's so interconnected with not only for hormone regulation, but also many other different pieces for longevity and health span. So Joi Blokes just added our at-home gut health testing, which is our shotgun microbiome. You can do it at home. It's simple. I've done it. It's, they make it so easy and
Not
convenient
pooping in a French
to
fry
do.
container. Like the ick factor. Like my patients were like, this is revolutionary. I don't have to poop in a French fry container. And it was like, when my patient said that to me, I said, I have to remember that as a licensed medical provider, like I'm desensitized to poop, but my patients aren't. They don't want, like the ick factor was high. So you're right. It is, you get to do it at home. The ick factor is little to none. And I have much better compliance. So for everyone listening, compliance just means my patients actually do the test when it's ordered, as opposed to it sitting in their kitchen counter for like months, not being done.
Exactly. And you don't need very much of it. I remember backpacking, got a parasite, and I had to bring a sample into the hospital. I remember in a brown paper bag, which was not a pleasurable experience. So this is much easier, so quiet, convenient. You return it, there's a return label. And everyone here who's listening, utilizing Gut 15, you'll get 15% off that at-home gut health test. So please utilize it, learn a little bit. And then also, they can be a little overwhelming when you get that raw results because it's just a lot about bacteria, which it can be a lot of information, which is also when you utilize providers and people who are educated in that space. For us, you'll utilize our team to give you practical things to how to digest it all, no pun intended, because it is a lot of information there. What are some practical things you can do with that information? And we help guide you through that just to make it a little bit easier because it can be a lot.
Well, and I was going to say, I think that's the key. Like I would say to any patient, like those at-home testing kits are helpful, but then if you don't have someone to review it with you, it can be very confusing. And I'll be honest, like even as a clinician myself, the first couple that I did, I actually would get on with the scientist with because I had questions myself. So I think it's a really like win-win for patients when they can actually speak to someone that's knowledgeable and then they can get their questions answered. And then it makes a great deal more sense and it's more actionable and valuable for that matter.
Absolutely. As we're starting to come closer to end of our session, I could talk about this for a long time. You are so knowledgeable, Cynthia. I so appreciate you. If anybody has any last minute questions, feel free to drop them in the chat. Thank you just everybody also for joining the call. Your guys' interest, learning about your health and what things can influence your health is being an advocate for yourself, which I think is so important. Finding people who are listening, doing the microbiome testing, understanding the impact that the microbiome plays, food, lifestyle, as we said, stress management being those fundamental pieces. And then when you're, in that perimenopause, menopause transition, and maybe you're adding on some HRT, don't forget about that gut microbiome. We want them to work effectively, and we want you to feel good. And so not missing out little pieces, look at the whole person. And also, again, a reminder to get Cynthia's book, read more. If you're interested now at what we're talking about, get her book, The Menopause Gut. You're going to learn so much more in there as well. So pick your copy out today. But again, for everyone watching, thank you so much for giving us a deeper understanding on that gut hormone connection and some real tools that we can walk away with and start using for not only for ourselves, but also for my patients. So I wish everybody a really beautiful rest of your day. And thank you so much, Katy and Cynthia.
Thank
Thanks,
you both.
everyone.
Thank you, Cynthia. Thank you, Lanae.
Thank you.
Bye, guys.